Hello everyone, turning your mic on helps. Hi, it's Steph here at ACVID. Welcome back to the DFAT Disability Inclusive Development webinar. My name's Stephanie Curry, I'm in the Learning and Development team here. And with me is Mika Kontiainen from DFAT, freshly back from a myriad of events, and he'll be speaking us through that, building on the last webinar that he gave last month. He has advised that we can take questions throughout, so you can use the chat function. Because there's so many of us, we're absolutely at capacity on this webinar. There's 50 of us on here. Maybe keep questions to a minimum if you can, bearing in mind that we should have enough time at the end for questions as well. You may wish to take a screenshot of that. Otherwise, it will be available on the YouTube channel at the end. There's also a Survey Monkey at the end. It does take a little while to pop up depending on your connection. Really appreciate your feedback. It only takes a minute to fill out. So with all of that, looks like we've got a lot of people on. I'll hand over to Mika to deliver the webinar. Thanks, everyone.
All right, good morning, everybody. Before we begin, I wish to acknowledge the Ngunnawal people who are the traditional custodians of this land on which I'm certainly meeting, and pay my respects to the elders of the Ngunnawal Nation, both past and present. I extend this respect to all Aboriginal and Torres Strait Islander peoples who may be in attendance today. So, as Stephanie said, my name's Mika Kontiainen. I'm the Director of Disability in the Development Policy Division of the Department of Foreign Affairs and Trade. That means it's my honour and privilege to be responsible for looking after... my voice is a bit soft. Let me just adjust the microphone. Is that any better? Testing? That's better, okay. All right, so as I was saying, as the Director of Disability, my responsibility is looking after disability inclusive development for the Australian Aid Program. I also look after disability human rights through our international engagement through the UN system and other human rights arrangements. Today, I wanted to build on the webinar that we conducted some weeks ago, which unfortunately wasn't completed due to technical issues. However, what I'm going to do today is talk very briefly about why disability is important, why disability inclusion is important, a little bit about the DFAT strategy and the strategic framework that underpins it, and then go on to talk about broadly our approach to disability inclusive development, particularly what DFAT has been doing to build capacity within the organisation to better implement disability inclusion through the aid program. I'm going to then talk a bit more about our international disability partnerships, some of the international partners that we are working with, and then sort of finish off with some recent developments that have happened internationally. As Stephanie said, I've just returned to Australia last week after a round of meetings and events in the United States, in Washington, DC, Boston, and New York at the United Nations, and I'd like to share with you what the outcome. Okay, I think we're back online. Can anybody hear me? Can just somebody type into the message to confirm that I'm back online? Yes, I am back online. Excellent. So, DFAT recognises that international development assistance must actively include and benefit people with disabilities to be effective in reducing poverty. We know that people with disabilities account for around about 15% of the global population. That's around 1 billion people. And that 15% prevalence rate varies across the world. 80% of people with disabilities live in developing countries, and in many developing countries the prevalence rate is probably around about 18%. There are some places such as Sri Lanka and the northeastern Tamil areas which were very badly affected by the civil war, where the prevalence rate of disability exceeds 20%. So about 1 in 5 of the world's poorest have a disability, and most extended families include someone with a disability. So people with disabilities and their families are also overrepresented among the poorest in society. Physical, social and attitudinal barriers can, slide has gone backwards. There you go. People with disabilities and their families are also overrepresented amongst the poorest in society. Physical, social, attitudinal barriers can result in fewer educational and economic opportunities for people with disabilities. And women with disabilities in particular face multiple disadvantage due to discrimination on the basis of their gender and their disability. So this exclusion can have significant negative consequences for a country's economic growth and poverty reduction efforts. There are some studies that have estimated that national economies lose around about 5% of national GDP when people with disabilities do not have equal access to employment. Australia, as a party to the United Nations Convention on the Rights of Persons with Disabilities, has committed to ensuring that our aid program and our humanitarian efforts are inclusive of people with disabilities. This is in accordance with the CRPD Articles 11 and 32. The UN CRPD, the Convention on the Rights of Persons with Disabilities, defines disability as persons with disabilities include those who have long-term physical, mental, intellectual, or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. That is, disability is conceptualized as the interaction between the impairments and the barriers that exist which prevent full and effective participation in society on an equal basis with others. Now, DFAT's definition of disability in our disability strategy is almost the same as the UN definition. The one difference is that DFAT also recognises episodic impairments. So not just long-term, but also episodic physical, mental, intellectual or sensory impairments. So the slide that you see now is taken right out of DFAT's disability strategy, and it shows the strategic framework which underpins all our disability inclusive development efforts. If you start at the bottom of the framework, it notes that the approach we take to disability inclusive development includes taking a twin track approach and promoting reasonable accommodation for people with disabilities. And I'll explain this shortly. It also highlights in the next row above the sectors that provide the most opportunity to strengthen disability inclusion, which is where we focus our efforts. That doesn't mean that we don't focus elsewhere, but most of our efforts go into these 4 opportunity areas, namely supporting governance for equality through the implementation of the CRPD, It should be noted that governance includes equality of access to appropriate healthcare. Secondly, focusing on enabling infrastructure and accessible water, sanitation and hygiene. Thirdly, ensuring inclusive education and skills. And fourthly, building resilience, including humanitarian assistance, disaster risk reduction and social protection. These 4 opportunity areas that we focus on, our efforts are maximised through following 4 guiding principles. And those guiding principles are firstly, supporting an active and central role for people with disabilities, and that's consistent with the principle of nothing about us without us. Secondly, developing policies and programs based on evidence. Thirdly, taking into account the interaction between gender and disability. And fourthly, improving inclusion of a diverse range of people with disabilities. What that last principle recognises is that there is a huge diversity in the types of impairments and therefore disabilities that people have across the world. The most commonly, the disabilities that are most easy to recognise are the ones that a person without a disability can readily see. So somebody who might have a mobility impairment, a wheelchair user, for example, or somebody who is blind or have some other vision impairment. However, people who have a hearing impairment or people who have an intellectual or psychosocial disability tend to be less visible and therefore less likely to be included in development efforts or indeed included in the discourse around disability because they are not so obvious. So we all do all this in order to achieve the objective that disability inclusive development, which is to improve the quality of life with people with disabilities in developing countries through enhancing their participation in the aid program as equal with others. Now, also we do it to reduce the poverty amongst people with disabilities, and finally improving equality for people with disabilities in all areas of public life, including service provision, education and employment. So the next slide you see should be of some railway tracks. And the railway tracks symbolise what we refer to as the twin track approach. The twin track approach does 2 things, or aims to do 2 things. One is it looks at mainstreaming disability inclusion so that general aid interventions and programs are accessible to people with disabilities so that they can participate in and benefit from them. The second is to provide support to disability-specific programs that are focused on people with disabilities in order to increase their capacity and identify and overcome barriers experienced by them. Disability-specific activities tend to be comparatively easier, and they are, for example, providing support to disabled people's organisations or running any particular program that directly benefits and is focused on people with disabilities. Mainstreaming, however, is something that personally I believe we can make more gains on, and certainly in the DFAT context in particular. So if you think of the Australian aid program, which is almost $4 billion a year, the aim is to make all those aid investments as inclusive of people with disabilities as we possibly can. So that means that if you are delivering an education program or a health program or a governance program, you design and implement that program so that it is inclusive of everybody from the very beginning. And when we talk about inclusion, we actually really should be talking about inclusion of people with disabilities, women and girls, people from various ethnic minorities, people who might be living in remote rural areas, and so forth. And broadly speaking, that's what DFAT is seeking to achieve, a completely inclusive disability, completely inclusive programs. But my role, of course, is focusing on disability inclusion, and that's what we're talking about today. So, what I wanted to move on onto next was what DFAT has been doing to actually build the capacity of the entire organisation to be more inclusive in the work that we actually do. So, the things that I want to talk about are the strategy that we have, what we do regarding monitoring and evaluation, the technical assistance that we provide across the program, the work we do in country to build the capacity of Australian missions to deliver disability inclusive development, some work that our Office of Development Effectiveness is doing around an evaluation of disability in DFAT, and finally the Disability Inclusive Development Fund, or the DID Fund, which has just recently been implemented. So, first of all, when it comes to capacity building, the important starting point is that we actually do have a clear strategy, and that is Development for All 2015-2020. The strategy was launched last year, and it aims to strengthen the inclusion of people with disabilities in Australia's aid program. What's really important about the strategy in terms of capacity building is that it provides a very clear public articulation of Australia's commitment to disability inclusive development. Many of the strategies that DFAT have are internal documents, but this particular strategy is externally focused and demonstrates that there is a political commitment and leadership to actually driving disability inclusion. The second thing that we're working on that helps build the capacity of the entire organisation to actually develop and implement disability inclusive development programs is to actually require that they be reported on. So within the Australian aid program, any aid investment that is worth more than $3 million goes through an annual monitoring and evaluation process where the efficiency, effectiveness, quality and so forth of the aid investment are assessed and reported against. And as part of that evaluation process, there are two questions that every aid investment, every aid program that's worth more than $3 million is required to evaluate against. The first question is a process question, which is to what extent have our development efforts identified and addressed barriers to the inclusion of people Actually, my apologies, I just realised that the two questions are reversed on the screen. The first question on the screen that you see is an outcome question, and that is the extent to which barriers have been identified and addressed for people with disabilities. The second question that's on the screen in front of you is a process question, and that is the extent to which people with disabilities have been involved in the planning, implementation and monitoring and evaluation of the program. So what we found is that, I think most people who work on any M&E programs will find is that if you actually are required to report on something, you're more likely to actually do it. So for a couple of years now, we've been requiring all aid managers to report on the extent to which they are being inclusive through these M&E questions. What they've actually shown us is we've got a great deal of room for improvement. The last round of analysis that we did on the M&E questions against these two shows that just over half of Australia's aid investments are assessing themselves as being satisfactorily inclusive of people with disabilities. How the quality of that reporting is still something that we're investigating, but at least it's starting to give us a baseline on how well we're doing and an opportunity to actually improve on it. Incidentally, there are similar questions that we actually have for our international partnerships, where Australia provides funding to our international partners to actually deliver development activities, and where we actually ask our partners, for example, our UN partners, the degree to which they are being inclusive of people with disabilities in the work that they're undertaking. So having talked about providing a clear direction, a public commitment, and leadership, we've got a system in place that requires programs to report on how well they are doing disability inclusion. The third thing that we do is actually provide them with the means of actually being able to be inclusive of people with disabilities. And one of the ways that we provide the means is through the provision of technical assistance. Now, at its most basic level, all Australian missions around the world and all DFAT program managers who manage aid investments have access to technical assistance through a portal called DID4All, which you can see on the screen before you. So the portal is an element of a partnership that DFAT has with CBM Australia, whereby CBM Australia provide us with technical assistance to help implement disability inclusive development programs. The team that I manage in Canberra, which is the central policy team for disability inclusion, is quite small, and our capacity to provide technical assistance to all the Australian embassies, high commissions, and other missions around the world that deliver aid investments is limited. So in order to assist aid managers who sit in Jakarta or Hanoi or Honiara, Harare, or anywhere else for that matter, we have an arrangement with CBM whereby, and through this portal, whereby any DFAT officer can log on to the website. They can submit an online request for technical assistance, and if that technical assistance requires 3 days or less of work, it's automatically approved and done in a reasonably quick turnaround, depending on what other time pressures are occurring at the time. If a post-ric seeks technical assistance on a program that requires more than 3 days worth of work or requires travel, then the request comes back to Canberra, back to me, and for my approval. But so far, I don't recall that we've actually turned down any particular requests. The DID4All website, it is worth for you to actually have a look at, because there is a public and a non-public side to it. So the non-public side is where all the requests from the missions come in, but on the public side there is a whole lot of resources that are made available by DFAT and CBM Australia to anybody to actually improve the disability inclusive development work that they are doing. So I strongly encourage you, when you get a chance, to go into the site, did4all.com.au, and have a browse and have a look at all the really useful information that you can actually find there that will actually help you build your understanding of disability inclusion and give you some very useful tools and tips as to how to be more inclusive of people with disabilities. The other thing that we do to build capacity of our missions is to actually provide in-country support. So Australian aid program, about 2/3 of our aid investments are managed by embassies and high commissions in country. About 1/3 goes through a major international and regional partnerships, but the majority of the Australian aid program is delivered through country programs, country and regional programs, which are managed in country at the Australian mission, where the ambassador or the High Commission, is ultimately responsible for decisions. Okay, I think the microphone just moved. Any better? Yes. All right. So where was I? Yes. So it's the ambassador or the High Commission at our mission overseas who's ultimately responsible for decisions around how aid programs are implemented and how aid investments are made. So, for example, with Papua New Guinea, it's the High Commissioner in Port Moresby who is responsible for the making the final decisions around almost $500 million a year of aid investments. So what we seek to do is actually build the capacity of the Australian Embassy, Australian mission staff in country to identify opportunities for disability inclusion and to be able to actually go forth and implement it. So the way we do this is that where a mission asks for it, that is where we've got a very clear indication that there is that the head of mission is committed to this work. We will actually send a team consisting of staff from my section and from CBM Australia, and they will travel in country to the mission and spend about a week working with the mission, providing training, briefing, and so forth. They'll cover the disability strategy. They'll talk about the policy and political context of why disability inclusion is important. And this is very important because many of the staff at the embassies are focused on the bilateral relationships and on the politics of the relationship between Australia and the partner country. We'll then talk about, provide briefing on what is disability inclusion, how programs can be made more inclusive, and then there'll be a series of one-on-one sessions with program managers looking at individual programs and looking for opportunities to make those programs more inclusive of people with disabilities. Interestingly, and very importantly, is that all that training is provided in close collaboration with local disabled people's organisations, consistent with the principle of nothing about us without us. So prior to any in-country visit, CBM Australia will use its networks to contact disabled people's organisations in the country that we are going to. They'll work with those disabled people's organisations to help refine and contextualise the training for that mission. And then when the training is being delivered, the training is usually delivered in partnership with representatives from the local disabled people's organisations in the training itself. What we find is that helps provide local context for the missions and provides a local context for what is otherwise generic training, but it also helps to build and establish and build linkages between the mission and disabled people's organisations, which is really important because, as you will recall from the earlier slide, one of the things that program managers are expected to do is to engage with people with disabilities and or disabled people's organisations in the implementation, in the design and implementation of aid investments. So since we launched the strategy in May of last year, we have conducted, I think it's about 12 in-country capacity building visits, and we are currently planning the next phase of visits, and there's probably going to be another 8 or 10 that will take place next financial year. What's really impressive about that is that it actually shows the level of commitment that we are getting from the Australian diplomatic network and from the heads of missions across the region and across the world on disability inclusion. So moving on. One of the other things that we are just doing now is that the Office of Development Effectiveness, ODE, which is a semi-independent evaluation organ of DFAT. Think of it as an auditing organisation. Sorry, I'll just go pause there for a moment because Jan's actually asked a question about can ANCP partners take part in the in-country trainings. So that's certainly possible. We leave it to our partners at CBM Australia to actually identify who are the most appropriate people to actually participate in the training. But what we have done on a number of occasions is when we've delivered some modules of the training in country, we've worked with the mission to identify who should be involved in the training, and involving implementing partners is always something that we look forward to doing. And in most cases, from recollection, we've had implementing partners in country participating in some of the training, either sitting in on the same sessions as the DFAT program managers, or we've actually run a separate session for the implementing partners themselves. And of the sessions that we've conducted so far that I've attended myself, I think what's really effective is actually having the implementing partners and the DFAT mission staff in the room together, talking about disability inclusion with the facilitation of disability section, CBM Australia and the local disabled people's organisations. So going back to the ODE strategic evaluation, so we have within DFAT this independent auditing body, ODE, and they conduct audits and evaluations of issues that are of strategic significance to the department. And so what was agreed with ODE earlier this year was that ODE will conduct a strategic evaluation of what DFAT has been doing to support people with disabilities through the AID program. The evaluation's got 4 distinct phases. You can see what those 4 are on the screen in front of you. The first phase has already commenced, and that is a fairly technical component where the ODE evaluators will be going through all the M&E, the monitoring and evaluation reporting that we have done so far on disability inclusion, and trying to build an evidence base of how effectively we are doing using the reporting and M&E arrangements that we have at the moment. I'm actually quite hopeful that the evaluation will also provide us with evidence of how effective that monitoring and evaluation framework is, and whether we actually need to make any changes to it. The second, third and fourth phases of the review will probably kick off fairly soon. The independent evaluation team that's working on it will be working with people with disabilities to actually help deliver on the training, help deliver on the evaluation. And I am hopeful that we will actually have the results of this evaluation by early next year. And when it is complete, it'll be an extremely useful and powerful management tool, because a ODE evaluation is, firstly, when it's completed, is actually published, so it's made public, as is the management responses to any recommendations that are in there. So while DFAT holds itself up as being a global leader on disability inclusion, we are actually putting ourselves to the test, and we will actually be sharing what the evaluation shows and what it finds with our broader constituency and partners. So the other thing that we're doing on capacity building is around what's called the Disability Inclusive Development Fund, the DID Fund. So this was something that we recognised about a year ago when we were looking at the central disability budget that we have. We were looking at the central disability budget that we have, which is $12.9 million a year, and looking at the proportion of funding that was going into, say, international partnerships, into supporting program delivery on the ground, into research, into capacity building, and so forth. And one of the things that we realised as we looked closely at how DFAT was delivering disability inclusive development, and as we were talking with our partners, was that quite often, if you were trying to mainstream a disability into a larger program, such as an education, health, or governance program, that often what was preventing program managers from doing so was not just the technical knowledge and the awareness, but also just that little bit of extra support that would enable them to integrate disability into the program from the outset. So we developed this concept of a DID fund, the objective of which is to strengthen disability inclusion in the aid in country and or regional aid investments, particularly across the Indo-Pacific region. And what we're doing is providing technical assistance and up to $5 million per financial year for successful programs that apply for this funding. The idea is that each successful program that applies through this competitive internal round would be eligible for up to $1 million a year and a significant amount of dedicated technical assistance. The first round of the DID fund, which was advertised a couple of months ago, proved to be far more successful than what we actually anticipated. First of all, we received 31 applications from across the Australian Diplomatic Network. The requests were seeking up over $42 million in funding and 2,000 days worth of technical assistance, which is far in excess of what we could actually possibly provide. But in the end, we selected 7 proposals, which are now just starting to move forward in terms of implementation. One of the ideas with the DID fund is that it will, by supporting a handful of programs across the region, these handful have a breadth of thematic areas that they cover, and they have a broad spread of geography that they cover. We're hoping to demonstrate more effectively to the Australian program managers how you can actually do disability inclusion more effectively. So by having a particular program, having one aid investment in one mission being driven as being very inclusive of people with disabilities, we're hoping that the other program managers will actually learn from that. Likewise, we're looking to actually build and learn from how each investment is made more inclusive so that we can then share the lessons learned more broadly. One of the other consequences of the DID fund process was that it generated a huge amount of discussion across DFAT and throughout our missions about the ongoing importance of disability inclusion. And so while only a small number of proposals were actually funded, many of the missions are now looking to see what they can do within their own budgets to actually implement some of the proposals either in whole or in part. And the level of overall awareness around disability inclusion across the missions increased even further. And it may well be that the launch of the DID fund had more of an impact than did the actual launch of our strategy a year ago. Now, the funding that's available is it's only DFAT program managers that can apply for this, for the funding. However, it is possible if there is an implementing partner in country, if they want to work with a mission and the mission wants to put forward a proposal, then they can. At the moment, we don't have any plans for conducting an immediate second round of funding proposals. So we're having just closed the first round, we're now going through the process of beginning implementation, and we'll see how well that progresses, and then what the funding opportunities are in future financial years as to whether we can actually conduct further rounds of the DID fund. It is very much dependent upon what the budget will accommodate, and that, of course, is a matter for the incoming government. So, having talked about some of the things that we're doing within DFAT to build the capacity of the organisation to actually deliver disability inclusion, I'd like now just to talk a little bit about some of the international partnerships that we actually have. As I mentioned, the central disability budget is $12.9 million a year, and over half of that goes to funding partnerships with some of our important international partners who are helping to drive disability inclusion globally. The partnerships that we actually have, and you can see some of the partners that we have there on the screen, are aiming to do broadly three things. One is strengthening the capacity of disabled people's organisations. So we have the partnerships that we have with the Disability Rights Advocacy Fund, with the International Disability Alliance, with the Pacific Disability Forum, and also the International Foundation for Electoral Systems, all work towards helping to build the capacity of disabled people's organisations in developing countries. This is important, and it's consistent with Australia's view that civil society organisations should have an active role in their countries. And in the case of disabled people's organisations, the principle of nothing about us without us means that it is imperative that disabled people's organisations and people with disabilities have a voice in any decisions that impact upon them. In many developing countries, however, civil society organisations in general and disabled people's organisations in particular tend to be weak or embryonic or lacking in capacity to be effective advocates for their own constituency. So Australia does provide funding through our partners to help build a capacity of disabled people's organisations to be more effective advocates for the rights of people with disabilities in their own countries. A second area that our international partnerships focus on is promoting disability in the 2030 Agenda for Sustainable Development. In this, we think we were quite successful. Australia's voice throughout the process leading up to the adoption of the 2030 Agenda for Sustainable Development was consistent and helped achieve a result whereby 5 of the goals and 7 of the targets now explicitly refer to persons with disabilities. We achieved this by supporting advocacy by IDA, the UN Special Rapporteur on the Rights of Persons with Disabilities, and various other civil society groups. And you'll no doubt recall that the previous Millennium Development Goals, the MDGs, were completely silent on people with disabilities, whereas now the Sustainable Development Goals and the 2030 Agenda are very explicitly focused on including people with disabilities in our development efforts. The third significant area where our international partnerships focus on is building global evidence and data collection capacity through our partnerships with the United Nations Statistics Division and the Washington Group on Disability Statistics to allow for better tracking of progress for people with disabilities. And so what I'd like to do is just digress for a moment and talk a little bit about the Washington Group questions, because if you haven't heard about them, you should have. So, data and evidence to support disability inclusion is really important at the global, the national, and the programmatic level. At the global level, if we cannot actually monitor the implementation of the SDGs if we don't have the means to collect internationally comparable data on people with disabilities and how effectively they are being included in development efforts. At the national level, most governments around the world make significant macroeconomic decisions around budgetary allocations based on the evidence that's before them through data such as is provided through censuses and administrative surveys. And if those data sets, if a national census, for example, does not adequately and effectively identify people with disabilities, it becomes all too easy for decision makers to actually ignore the needs of people with disabilities. Finally, at the programmatic level, if we're delivering on any program, any development program, if we don't have data that actually identifies the degree to which people with disabilities are being included, then we don't actually know how effective our programs are. And indeed, there is a risk that if we don't actually measure it effectively, we might actually find ourselves inadvertently entrenching discrimination and exclusion of people with disabilities by rolling out a program in a developing country that actually improves the quality of life of people, of most people, but doesn't reach people with disabilities, so that the quality of life of everybody except people with disabilities improves, and the quality of life of people without disabilities remains the same, and therefore the gap continues to grow. So, the Washington Group is a body that was established by the United Nations Statistical Commission over 10 years ago. So whenever the United Nations Statistical Commission, which is made up of the national statistics officers of member states, so for example, the Australian Bureau of Statistics is a member of the UN Statistical Commission. When the UN Statistical Commission has an intractable statistical problem, a problem about how do we collect data on X, they will establish what they call a city group. The city group is named after the first city in which it meets. So 10 years ago, the best global statisticians in the world realized that there was a real gap in capacity on how to actually collect data on people with disabilities. And so they established a city group. It met in Washington for the first time, hence it's called the Washington Group. The Washington Group city group, which is made up of certainly many of the UN member state national statistics officers, spent 10 years developing a very short set of questions that they can use can be the best tool for using to collect comparable data on people with disabilities. The initial idea was to come up with a tool that could be inserted into national censuses, because that's what the Washington Group's initial focus was on. And in doing so, they recognised that space on a national census is very limited and very expensive. It costs a lot of money and takes a lot of effort to conduct a national census, and every question that you actually ask increases the cost and increases the time and the resources. So you need to be very clear and succinct in how you actually ask your questions. So they developed this tool called the Washington Group of Short Set of Questions. There are 6 questions that were developed, and I'll show those to you in a moment. And those questions have been tested in all sorts of different language and cultural settings, and they are found to be quite effective. They are now recommended for use in all national censuses. They've been endorsed by the UN as the means to disaggregate by disability status for the 2030 development agenda. And DFAT is actually strongly supporting their use in all data collection systems, from censuses, administrative surveys to program level monitoring. And so this is relevant for ACFID members and others, because we are encouraging all our partners that if you are collecting data on individuals, if you're collecting data on the impact of what you are doing on individuals, we are encouraging you to actually include the Washington Group questions in that data set that you're using, so that you can collect effective, comparable data on people with disabilities, and to be able to disaggregate it against the other information that you are collecting. So, the Washington Group questions. Now, here's an example of why they are so important. What's been found is that if you simply ask questions around, are you disabled, you don't tend to get a very good result. You don't get a good result because people don't necessarily self-identify as having a disability. Because of the stigma and discrimination, people don't want to reveal that they might have a disability. These and other factors mean that any question that asks a straightforward, are you disabled or do you have a disability, tends to underrepresent, and quite significantly underrepresent, the number of people with disabilities. So the example that you've got on the screen there is from Zambia, which conducted a census in 2000 where they asked the question of, are you disabled in any way, and then they went and asked questions about what is your disability. If you look at some of those categories in there, they some of them are quite value laden. The disability prevalence rate that that Zambian national census of 2000 revealed was 2.7%, and we know that globally the disability prevalence rate is more like 15%, so that's a clear underreporting. 2006, Zambia conducted a survey, a national survey, using the Washington Group questions, and you can see what the Washington Group questions are there. There's 6 of them, and they focus very much on impairments, on functionality. So the questions make no reference to disability whatsoever. They simply ask, do you have difficulty seeing, hearing, walking, remembering, self-care and communication? And then it's not a yes/no answer. It's there's a range of 4 responses: no difficulty, some difficulty, a lot of difficulty, or cannot do it all. And the standard is that if you have a lot of difficulty with any of those 6 domains, you're considered to be a person with a disability. When that survey was conducted in 2006, the prevalence rate was identified as 8.5. Now, the Washington Group questions are not perfect. They are the best that actually exist at the moment, but they have some limitations. One of the limitations is that they don't directly address the issues around psychosocial disability and intellectual disabilities. The reason for that is that after 10 years of effort, the experts have not been able to identify a simple question or simple couple of questions that you could actually ask that will actually accurately reflect on this. So the Washington Group questions don't capture everybody with a disability. They capture most people with a disability, and indeed people with psychosocial and intellectual disabilities often, but not always, do have difficulties remembering or concentrating, or with self-care, or with communicating. Now, the other limitation of the Washington Group questions is that they don't work very effectively with young children. So there is more work that is being undertaken on, I should move the slide across. There is more work that's actually being undertaken on developing a child module And there's also work being undertaken on participation and functionality. There is also a extended set that the Washington Group is working on that seeks to more effectively address psychosocial and intellectual disabilities as well, and that's that's work in progress. So Laura has asked, I thought there was another set of questions that cover mental and health issues. Well, yes, that's the extended set of questions actually does go into trying to address that more effectively. But the limitation is that if you can only ask a small number of questions as part of a broader survey, asking a whole lot of different questions around psychosocial and intellectual disabilities often becomes impractical because you just don't have the resources to do it. So going back to what I said at the outset, the Washington Group questions are not perfect, but they are the best tool that's available at the moment. They are particularly useful in low resource settings, and they can be used in conjunction with any other data collection tool that you are using. If you need to actually collect more detailed information about people with disabilities, because you are conducting a program that is directly aimed at people with disabilities, for example, then you should actually ask more questions. The Washington Group questions should be seen as the minimum questions that you ask. And then depending on what your need is, you can go and ask further questions. All right, that's enough about questions for the moment. What I now wanted to just finish off on is some recent international engagement that Australia has been engaged in and which has kept myself, my team and other parts of DFAT very, very busy in the last month or so. Three significant things that have occurred recently are the World Humanitarian Summit in Istanbul, the annual Conference of States Parties to the Convention on the Rights of Persons with Disabilities, which was in New York week before last, and also the Global Action on Disability Network, which held a meeting in New York immediately after COSP. So, the World Humanitarian Summit. One of the great outcomes out of the World Humanitarian Summit was the launch of a new charter on inclusion of persons with disabilities in humanitarian action. This charter urges government representatives as well as leaders of NGOs and funding organisations to ensure that their future humanitarian actions are inclusive. Australia and Finland were the two UN member states that drove this issue the hardest, working in close support with a number of international INGOs. There was a special event in Istanbul to actually mark the launch of the charter and the commitments of member states to the charter. Australia, of course, endorsed it right from the outset, and we actually helped draft it. The work was driven from Geneva, where the Australian Finnish embassies working with the INGOs spent many months actually developing the charter, negotiating it, and then having it ready for endorsement in Istanbul. Australia, as I said, has endorsed the charter and is committed to practical action towards its implementation. We are now working with our partners through the networks in Geneva to actually develop guidelines for its implementation. So that outcome was actually quite significant and will, I expect, lead to much better action around humanitarian responses, which up until now have had a disappointing tendency to ignore people with disabilities when relief efforts were being delivered to areas that were affected by conflict or natural disaster. week before last was the Conference of States Parties to the Convention on the Rights of Persons with Disabilities, which was held in New York. It also marked the 10th anniversary of the signing of the CRPD. The CRPD COSP is probably the most significant annual international event that brings together global partners working on disability human rights and disability development issues. And throughout the week, Australia was actively engaged and recognised as a leader in the work that we were actually doing. We hosted a number of side events, participated in panel discussions, held lots of bilateral discussions with partners looking for opportunities to better coordinate the work that we actually do. And we made a point throughout our representations to continue to push and to push hard on the rights of persons with disabilities and on the importance of providing space within the UN system for civil society organisations, for disabled people's organisations, and for national human rights institutions to be able to participate and to advocate. This is actually particularly important because within the UN there are a number of more conservative member states that tend to try and marginalise the role of civil society. And Australia has a very strong view that civil society organisations have an important place and an important role in these sorts of discussions. As an aside, I think one of the highlights of the evening, of the week, in fact, was that the permanent mission of Australia to the UN and the International Disability Alliance hosted a celebration marking the 10th anniversary of the CRPD, and that brought together several hundred representatives from government, civil society organisations, and the UN. In a very effective networking session. Of the photos that you actually can see on the screen there, the one in the middle, incidentally, that's me on the right. I'm sitting there, or kneeling there next to Vladimir Chuk, who's the Chief Executive Officer of the International Disability Alliance. The photo on the top actually shows part of the Australian delegation when we were actually sitting in the General Assembly Hall at the UN as part of the convention. So the COSP ran for 3 days. It was preceded by a civil society forum, and over the course of those combined 4 days, not only was the Australian government delegation very engaged, but we also had a good level of representation from Australian civil society organisations who were partly funded by Department of Social Services to actually be in New York and to help represent Australia's perspective. Now, the day after COSP finished, we held a meeting in New York of the Global Action on Disability Steering Committee. So GLAD, the Global Action on Disability, is a new international coordination mechanism that was established in London last year on the International Day of People with Disabilities, which is the 3rd of December. It was launched by the UK government and the International Disability Alliance. It was launched by the UK government and the International Disability Alliance. And since the launch, Australia has assumed the role of rotating co-chair. IDA, International Disability Alliance, are the permanent co-chairs, and at each GLAD meeting, the GLAD members will select a second co-chair. So Australia has been a co-chair for the last year, and we've been working very hard behind the scenes to try and lay the foundations of the GLAD network, which brings together bilateral donors, so bilateral donors such as DFAT, DFAT, and the aid agencies of countries like the US, Norway, Sweden, Finland, Germany, and so forth. It brings together multilateral organisations from across the UN, foundations that provide significant amounts of funding to disability, human rights and disability inclusion, and also private sector entities that have a strong interest in working on disability inclusion. So on the Friday of immediately after COST, so Friday 2 weeks ago, the group actually met in New York and was able to actually develop some very clear idea, a clearer idea about what it is that we can actually do together to be more effective. And as an example, if you have half a dozen bilateral donors, say Australia, UK, Germany, and the Nordic countries, are all interested in actually investing money, aid money, in a particular area, a thematic area, or a particular geographic area around disability inclusion. If we can more effectively coordinate with each other and plan more effectively, then we will actually be able to achieve better outcomes. And so up until now, there has been a distinct lack of effective international coordination in the work that is being done by all the various partners that are actively contributing resources internationally to disability inclusive development. The GLAD mechanism will actually help us to actually overcome that. The GLAD meeting that took place that week in New York actually re-elected Australia as the co-chair for GLAD for the coming year, and we are now looking at holding a GLAD network meeting probably in Germany in February, because the German development agency GIZ volunteered to host. So a GLAD network meeting will probably occur in Germany early next year, and in the meantime we're continuing to work on identify when the steering group has to meet and develop work plans around mapping who does what in disability inclusion, and start looking for better opportunities to coordinate and leverage off each other's efforts. So that's a summary of what I've actually covered so far. I spoke about why disability inclusion is important, talked about the strategic framework, our approach to disability inclusion, the various things that we are doing across DFAT to build the capacity of the organisation to be more effective in delivering disability inclusive development, what we're doing with our international partnerships, the Washington Group questions, and what's been happening in the World Humanitarian Summit, the Conference of States Parties, and on GLAD. And that is getting us close to the end of my slides. The second last slide that I've got here, other than my thank you slide, is some resources that you could actually tap into to help make your work more inclusive of people with disabilities. There's the generic email address for my team. You can access the strategy. There is also a very useful document called the Accessibility Design Guide, which was actually written back in the days of AusAid, but is still a very effective, very useful document that identifies the principles for universal design for the Australian Aid Program. There is the link to the Did for All website, which I spoke about earlier, and there is a link to the Washington Group questions. And that is the end of my formal presentation, ladies and gentlemen, and I note that we've now been going for about an hour and 10 minutes, so we've got a chance for some questions if there are any. As often happens when I deliver a presentation on disability inclusion, I end up bombarding people with so much information that I sometimes fear and suspect that people are just stunned. But Jan has asked a question, where do we find a list of disability focal point people for Australian missions? There is not a public list of focal points. However, if you have a particular mission that you are interested in, you can contact my team at disability.inclusive.development@dfat.gov.au, and we can actually link you up with whoever the person is. One of the problems, one of the challenges that we have is that because of staff changeover, any list that we actually put up will become rapidly out of date. So we find it's just easier for us to actually work this way. Also, some Australian missions are more actively engaged on disability inclusion than others. Those missions that have asked for and have benefited from an in-country capacity building visit by a joint DFAT CBM Australia team tend to be very focused and actively engaged on disability inclusion now. But some of the other missions that have not yet had the benefit of such a visit are still sort of struggling to understand what it all means.
Hi, this is just Steph again answering Anne's question about will the presentation be available on the ACFID Learning website. For those of you who came on a little bit earlier, the presentation and the recording of it will be put onto ACFID's YouTube channel, and I'll send around a link to that when I contact you all about this presentation. Or you could Google ACFID YouTube and you'll see the earlier DFAT presentations there, and this one will join it once we've been cleared by DFAT. Thanks, and I'll just hand back over to Maker.
All right, the DID for All portal, the requests that come through from missions vary. Some of them are program managers seeking assistance in doing a disability analysis, as in trying to identify what the disability situation is in the particular country or the context that they're looking at. Others are helping to do some basic disability inclusion design work, either at policy level or the programmatic level. And then more substantive requests can actually involve requests for CBM to provide technical assistance in working through the detail of how a particular program proposal can include people with disabilities all the way through. Of late, most of a lot of the requests came in from missions to the DID for All portal were in fact requests from the missions seeking assistance on how to make their applications to the DID fund more effective. So of the how the rollout of that new phase of that program can be more effectively made inclusive of people with disabilities. And on that, generally, a good starting point, the advice that we provide to our missions is that a good starting point for making any aid investment inclusive of people with disabilities is that go and talk to and engage with your local disabled people's organisations in the implementation, in the planning phases. So as you're looking at designing a new program, go and you're going through your consultation process with various stakeholders, remember that people with disabilities are important stakeholders, and if you engage with them, they will tell you what it is that is creating the barriers that prevents them from participating and benefiting from that program, and they can often tell you what it is that needs to be done in order to overcome those barriers. It's this focus on disabled people's organisations, which is why a lot of the work that we do involves building the capacity of disabled people's organisations and building the linkages between our missions and disabled people's organisations in country. So the question around questions that help measure quality of participation, I actually don't have an answer to that one. I'd have to take that on notice, unless, of course, any of my team happen to be listening in on this webinar and have got something that they could actually immediately contribute through the chat box. Um, but, um, but the data work that we are doing on is not focusing on the quality of participation, although I understand that there are quite a number of partners that are looking at ways of doing this in terms of conducting qualitative questionnairing, which can be quite a difficult exercise, quite a resource-intensive exercise, but there are certainly many circumstances where in order for you to actually better understand the impact of what you are doing, then you need to actually consider the quality of participation, not just the metrics of participation. All right. There's a lot of thanks that are coming through, and everybody's most welcome. I'll wait for one moment longer to see if anybody else has got any other questions, which I'm happy to answer. Just thinking about the questions around quality of participation, I'm not certain, but it may well be that in the Washington group link, with some of the other resources that link links to, that there is actually a possibility of finding stuff. All right, I think we're about ready to wrap up, so I will conclude there for the morning. Thank you everybody for your time this morning and for your questions. Please do take the opportunity of actually having a look at the various links that we've actually provided. If you're looking for support for your own organisation to actually be more inclusive of people with disabilities, I would suggest actually contacting CBM Australia, because they do work very closely with many of the ACFID partners. And of course, I and my team are more than happy to talk about what the Australian Aid Program is doing on disability inclusion. And you will find a lot of that information on the various links that are on this slide. So thank you.
Okay, we'll wrap up, and please remember to do the Survey Monkey, which will pop up on your screen any minute now. Thanks, everyone. Bye.